Doctor, something fluid passed through my mind, even though we have not discussed it spontaneous here. It's television. So television, it's a strange environment for connection in a way, but it can be the perfect tool.
Yes.
Can you show me a tool or an exercise of connection in this environment? Can we build something here?
The only thing that comes to mind is how we look at other people.
Yeah.
How we look.
How we look, yes.
Yeah, how we look.
Yeah.
I always like to connect back to mother and children, because this is the area where everything started. I have seen videos of mothers and children a lot, because this is the area when I was learning psychology. One of the experiences that touched me the most, when maybe as unethical to do it now, have a mother looking at the child, and then she looks away like this from the child, and the child is looking at her, and they made a lot of videos, and there's a pattern start to appear. The child wondering what happened, and then trying to attract her attention, and the child start to do something, and then the child develop a strategy to survive the situation, because now the child is disconnected. So now this is the survival mechanism, because the connection was taken away. If you're talking to a person and you look away, the person, the communication is changing. So I think the first thing that comes to my mind when you speak to somebody, you look in their eyes.
When I was trying to I don't know, to make thought, is here. You see, I'm losing your eye connection, and I was observing myself doing like this.
Yes.
And I was thinking, what the hell I'm doing? What's this? Why even now? You see?
Yes, yes.
So.
You know, there is a field between people when they're speaking. You probably read about this thing, and yes, there's something called intersubjective field. When the two people speaking, there is going movement. I actually think within the next 20 years, we will be able to have equipment to show,
measure,
and show it physically. Because now we can see the unconscious memory in the brain physically and scans. We will be able to, and when we see that, it would be a very big shock to us and how we treat each other, and how we connect with each other.
What's happened between us, Doctor, now? So you are always, from the start of the program, and not before, looking to me and connecting, and I feel the compassionate eyes. So receiving me, my objects, my personality. And for me, maybe sometimes being too much, or what?
Yes.
Even though I'm training for this.
Yes, yes. Many people tell me this in the courses.
Too much what?
No, not too much. Some people told me, I had many things to ask you, but I came and you looked at me, it was enough.
The presence.
That was enough.
The field.
This is the sense, you see, it's fascinating. I divert a little bit.
Please.
Whoever designed human beings designed absolutely everything, including problems to allow us to heal. So, everything that happened to us helped us to evolve. My life has been extremely difficult before, when I was a child. Everything that I see in therapy and the seminars had actually happened to me. And I had no connection with my mother. And I had a very painful childhood. Through that, I have learned what people need. So when I look at someone with compassion, I am looking at me with compassion at the same time.